This episode is brought to you by ProMensal.
We start getting drier. Estrogen is one of the biggest thing that hydrates our skin. So dryness is a big thing. So stop overwashing your face. General rule, just wash your face once a day at nighttime.
Welcome to this episode of Thriving in Menopause, brought to you by Prevention Magazine. I'm Andrea Duval, editor of Prevention, and today we're talking about our skin. At our age, we're probably noticing a few more laugh lines, perhaps mysterious new spots appearing. Wouldn't it be great to have a friend who could explain what's going on and what you can do without any of the beauty industry hype? Well, today I'm talking with Melbourne dermatologist Dr Shyamalar Gunatheesan. Shyamalar is the kind of person you'd really love to have coffee with. She's smart, she's kind, and incredibly wise. So today, imagine we're sitting in a cafe somewhere, and here she comes. Hi, Shyamalar. Thanks for joining us.
Hello, thank you for having me.
What are some of the common reasons people come and see you during their 40s and 50s?
Really, I think, it can start with coming in for a good skin check, making sure they don't have any underlying, sun damage that's caused skin cancers. And once that's done, once they have that bit of rapport and trust, the next question always seems to be, you know what, Shami, I'm just getting a bit tired looking, Why am I having a bit of the jowls? Why are my cheeks a bit saggy? Or can you see that frown line between my eyebrows? So I think it just lends that conversation very naturally. I mean, I am a woman in my 40s, so I can totally empathize. And you're just curious and wanting to know what you can do that sets you up for the next few years or correct some things that you're not maybe that comfortable with.
Okay, so tell me what you say to them when they present that way.
I go, okay, let me give you a mirror because, sometimes what I'm going to see may not be the first thing that catches their eye. So I think having that mirror in front of them while they chat to me really kind of crystallizes what bugs them, because tired can be, a multitude of factors. You could be genuinely tired and, had a big night and your eyes are a bit sunken or things like that. But really when someone looks in the mirror, it depends on how each person ages. So it could be that they're catching that corrugator muscle, which is right above your eyebrow, that you do that crinkling action and you get that number 11 in between your eyebrows. That really gets to people. From people think I'm angry at work, or my kids think I'm annoyed at them when I'm not. But for another person, it could be that mid face where they've lost that volume and they've got that flatness that's not reflecting light. And so your eyes look a bit more hollow. And then I've got women who probably might age more in their lower third, and they've got that, kind of lower jawline fullness and jowling. And perhaps, the lack of luminosity. So tiredness or sallowness can appear when you've got a bit of sun damage and you get a few little brown spots. You've got a bit of textural changes. And human beings were very, very perceptive. Like you can tell a fresh tight apple skin versus one that's been out for a few days. So it's really that light reflection that changes as we age. And then you've got that hormonal change that happens as women get older and our estrogen levels deplete. So I guess it just is it's so individual.
Okay, so what are some of the simple things that women can do to support their skin during their 40s? I guess, one of the nice things is we probably have a little bit more money to splash on products than we did when we were, say, 18 and playing at the Max Factor counter. And I know that science has evolved a lot in terms of what's available to us, but we get so bamboozled with so much hype from so many different advertisers that it's important for us to hear from somebody like yourself as to what really does work.
Spot on. I mean, I think women in our 40s where we've got that disposable income and we do want to look after ourselves. So the main thing I would say is work on your skin barrier, because in that demographic, we start getting drier. Estrogen is one of the biggest thing that hydrates our skin. So dryness is a big thing. So stop overwashing your face. general rule, just wash your face once a day at nighttime. You should not be washing your face in the morning unless you're excessively oily. So get a good cleanser that's really replenishing. Look for ingredients like ceramides, lipids. So you're almost kind of removing that makeup and pollutants in the nighttime, but hydrating it right away. The cosmeceutical industry has come leaps and bounds, but it's also a minefield. So look for key actives, like I'm a big fan of vitamin B3. That's niacinamide. So it's a bit of a multitasker. I would actually say take it orally also. So 1 gram of vitamin B3 has been shown in studies in dermatology units to reduce the risk of skin cancers. If you've had a basal cell or a squamous cell carcinoma, it actually reduces your risk of getting another one. So anyway, I think anyone living in Australia should be on that if you're not allergic to it or not unwell on it. So take it orally, take it topically. So I do like the vitamin C. Vitamin C is a key ingredient in making collagen, which is one of the big things that is in decline as we get older. So you want to be able to give your skin all the cofactors to make the plumpness, to give the hydration. So if you think of your big vitamins like vitamin A, I think everyone knows that's your multitasker. It makes fine lines and wrinkles disappear. It makes your pigment better. It teaches your melanocytes, which are your pigment-producing cells, to talk properly to your keratinocytes, which are the main cell type in your skin. It talks to the fibroblasts to make collagen. So if you think of ABC as your actives that you want to incorporate early in life, you're going to set yourself up very well for a healthy skin. So the difficult part comes in with how these ingredients are made, how well they penetrate into the deeper layers of your skin, what are you sensitive to. And so you do want to maybe get guided by an expert about what you need at each time. But I think I can safely reassure you that gone are the days of using Sorbeline and a bit of a bar of soap, because all these things do actually penetrate deeper into your skin and make a difference.
Wow, that's really interesting. One of the things that I really latched onto that you were just saying was you were talking about sunspots and damage. And I know that this is something that I've had girlfriends who have really been concerned about these spots that, we used to call them liver spots, age spots, and they get bigger and bigger. But it is quite remarkable that you can actually make them disappear now, can't you?
Yes. So, we talk about skincare, which will set you up so you don't get more, or they can definitely lighten it. But we have got appropriate lasers now that can completely make that go away. So, especially if you've got 1 or 2 of these liver spots on a lovely canvas, it can really age you unnecessarily. And I say, unless you really want to wear it as a badge of honor, let it be gone. Without any surgery or anything invasive. There are beautiful different lasers out there that can be set to your bespoke settings where it just almost magically drops off.
So tell me, what are some of the issues that you see women come to when they are in perimenopause? You've talked about how skin dries. For example, it's common for there to be pimples and acne, but it's quite different to teenage acne, isn't it?
Yes, we call it that kind of female adult acne, and you've got a peak in your 20s and 30s, and then we definitely have that perimenopause, postmenopause period. So it's more of that inflammatory cascade that's causing these little pimples. And while those fluctuating hormones of progesterone, estrogen are in decline, you do get these breakouts, because women, as we get older, when we hit that perimenopause period, we actually get more testosterone, or the androgens.
So you were talking about pimples and acne. Perhaps we can revisit that.
So, you get this inflammatory cascade that causes these little breakouts. I find that a simple tablet will definitely fix that, and we can recalibrate the hormones. But also at that moment in time, working on the hydration of your skin. I'm very pro gut health in this demographic, and actually in all demographics, because there's sometimes an element of rosacea as we get older too, where you get a bit more red You see, and rosacea unchecked can also give you these little breakouts. So you want to have that small gut, your overall bowel habits, and what you ingest can really make a big difference to the health of your skin to address these breakouts. So, less sugar.
So sugar and what we put in our diet then is reflected in the brightness or health of our skin.
Absolutely. So, I think all of us could benefit from a more of an anti-inflammatory diet, basic things like less sugar, less gluten, less dairy, certain foods like even not even too much nightshades and tomatoes can sometimes be a big thing in flaring people's skin. So, that kind of low FODMAP diet does have its merits. I mean, if you think about it, our gut's one of the biggest immune organs, and we know that the gut microbiome, all the viruses, the bacteria that live in our gut really kind of communicate to our skin. So more and more we're realizing there's a lot of crosstalk between the organs. So we want to make sure that we optimize that angle too.
Which is really interesting. I think it's very common for us to think that we can buy a jar off the shelf to fix the quality of our skin, but actually it requires a much more multifaceted approach. We need to be a little bit more mindful about all our lifestyle habits.
And actually that point when you mentioned about mindful about what we do, like research has shown that, if your brain is happy, if you're generally rested and you're in a good state of mind, you actually age a lot better than any cream or active can do. So that's fascinating. People that are stressed. I mean, I think medically we can hypothesize like, you got more adrenaline, you're producing more cortisol, that's going to make your oil glands more active, get more breakouts, get scarring, and you can definitely have that catabolic state that ensues when you're really stressed. But to actually see that in studies that, a more stressed, anxious, rundown person ages worse, it is very confronting, but I guess it's also enriching that you can do something about it.
Yeah. I want to talk to you about rashes and easily irritated skin. I'm sitting here at the moment with this eczema all over my hands. This is also a part of exactly what you're saying. It's not just our face, it's our skin all over that starts to dry.
Spot on. So I think perimenopause and menopause, one of the biggest thing is dehydration. It can, as we know, sometimes the vagina gets a bit drier too, but our skin being the largest organ, we tend to suffer from a lot of dryness. So we think we don't absorb as much water into our top layer, the stratum corneum. And we also tend to lose a lot more via evaporation due to various factors. So estrogen and the other hormones control how our fibroblasts produce something called glycosaminoglycans, which are almost these really thick water molecules, or water-based proteins. So like hyaluronic acid, everybody knows about that, but that's a good plumper. There's another major one called heparin sulfate that traps water. We tend to not have as much of that. So what can you do? It's not all doom and gloom. I say, have a quick shower. Don't spend ages in a hot, long shower. Don't over scrub your body. Just really wash the smelly bits of the soap-free wash and out you go. How you dry yourself matters as you get older. You don't want to be doing one of those big brushy towels and just kind of flake off your skin. You just really want to pat it dry. Like almost think back to how you would treat a little baby. You would pat it dry, and then when it's slightly moist, slap on a good moisturizer. So research has shown that if you actually have the skin slightly damp, that would increase your water absorbance and moisture absorbance from your cream. So you can do something.
Okay, we're just going to take a short break.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
And we're back. Shyamalar, let's talk about skin thinning, which sounds really alarming. And I guess I really want to I really want women listening to the podcast today to feel it's not all doom and gloom, but it's important to understand that these changes are taking place and we can actually support them better than ever.
I'm a very strong advocate of that. Like, I think knowledge is power, and also the cumulative small effect, the changes that you make in series will give you a big dividend at the end. So it doesn't have to be, lasering your whole body, for example. You can make these lifestyle changes. You can choose the right moisturizer, and you can have good sun protection that would help with this. So back to your question about skin thinning, medically, we do know that as estrogen levels decline, we don't produce as much elastin, which gives us our kind of stretchability to our skin. We don't produce as much collagen. So the dermis, which is that second layer of skin, just almost thins out. So as part of that natural process, I mean, it's something to talk to your GP or endocrinologist, because sometimes in the first 5 years, when you hit menopause or that perimenopause period, you do need a bit of HRT, which is hormone replacement, whichever way you want it to be, either oral or transdermal or tablets. You can make that, you can prevent a terrible decline later on in life. So that's something to have a frank chat to your practitioner about, if that is of a concern to you. There are pros and cons of being on hormone replacement. And with skin thinning, the other biggest thing is to do everything you can to stop photoaging. So be meticulous about your sun protection. You don't have to just rely on sunscreen. You might use UPF 50 plus clothing, for example, if you're out gardening or you're on the beach. So have all forms of sun protection, so you're not having that added insult of photoaging.
Which is interesting when you talk about that, because one of the areas that women show aging, and I guess it comes as a surprise, is our décolletage. I certainly wasn't aware that an average T-shirt gives you an SPF protection of about 5.
My tip with that is, a lot of us unwittingly, put perfume on our neck or our chest. It's almost out of habit. And, we've seen our mums do it and all of that. But anything fragrance seems to increase your sun damage by about 20 to 30%. And you almost get that pigmentation, something called poikiloderma of civet, where that's exactly it. You get that mottled brown, red pigmentation on your neck and your chest. And we really think it's that photosensitizing effect of botanicals, so maybe putting your perfume somewhere else where you're not sun exposed.
The back of the wrists, the old fashioned way.
Yes, or the back of the knees, So I think making those little steps makes a big difference. And, stretch down your actives. Like I've started putting my vitamin B3, my vitamin C. I go down to my neck and chest, do a sweep. It's left on your hand anyway, so catch the backs of your hands, get that cream to stretch, because once again, those little cumulative changes are going to make a big difference.
Let's talk for a minute about collagen. We hear a lot about it today. What is it exactly?
So really, it's a protein molecule. So it's one of the major structures in our dermis. So you've got the epidermis, which is the first few layers of keratinocyte skin cells. And then the next layer is where we've got our elastin, our collagen. So collagen in the skin is really 2 types, 1 and 3. And it's the basic structure that gives our skin bounce, gives our skin depth. So it's a very important protein. Very complicated how it's kept in homeostasis, because you've got molecules that make it up. So you've got pro-collagen molecules that will become then collagen. And then we're always in a flux of its natural breakdown. So you got collagenases that will then break down old collagen into waste material. So you've got this balancing act, and estrogen controls that via various mechanisms. So we've got estrogen receptors on our fibroblasts, which are cells that make collagen.
So these days we're sold a lot of collagen supplements, a lot of collagen skincare. Can you put a topical cream on it to make a difference in collagen? And will drinking a supplement really make a difference?
So that's a really good question and a tricky, controversial one. I think with my current understanding of everything out there, I do not see how scientifically putting on a collagen molecule as small as it is, because it's a big molecule, so it really can't penetrate through the different deeper layers of your skin. Even if they say they've made it into tiny layers and they put fancy peptides, it just doesn't make, dermatological sense how it can get through, because ultimately, your body will make collagen from amino acids, little protein molecules. So I would say no for that. In terms of supplements, that's where I think I've seen that space change. And research has shown that clinically, people who do supplement with good quality collagen, whether it's marine or bovine, no evidence for plant at this stage, I'm afraid. But, certainly with those animal-based collagen, there is better hydration of the skin. There seems to be better light reflection. There seems to be an overall clinical improvement. And one of the hypotheses or the mechanisms is that ingesting it into your gut might have feedback loops that cause your body not to break down your existing collagen as much. That's the only kind of theory that sits okay with me to justify it. But I think as a consumer, is there some merit? Yes. And if you can certainly find one that tastes good and fits into your routine and it's cost effective, I would say go for it.
Something else I want to talk to you about is facial hair. The sudden sprouting of hairs on the chin, a sense that the finer hair on our face suddenly grows a little bit longer. What causes this? And should you pluck, shave, or how can you deal with this?
So yes, that is sometimes very difficult, but happens to all of us. Really, as we talked about, as we hit into that perimenopause, menopause period, our estrogen, the more feminizing hormone, declines, and we produce more androgens or testosterone. We do anyway, premenopausally, but it's probably a lot more. So that kind of masculine angle, unfortunately, does result in that more wiry, thick hair. So with the wiry, thick hair, if it's black, you can just go for your traditional hair removal lasers. I actually like the good old-fashioned electrolysis for the really stubborn hairs. In the hands of a good practitioner, it's brilliant because it really gets down to that bulb, and it's you've got a couple of wiry hairs, so that's not going to take you ages to get rid of. Now, the bum fluff or the villus hairs that get a bit longer, joys of being a woman, really. That can be annoying, but over time, I've had patients really have good success with things like threading if they want to remove it completely. Even shaving, the one thing to probably myth bust is that shaving doesn't mean that your hair gets thicker. That seems to be quite prevalent in our thoughts that by shaving it, you're actually going to make it worse. No, you're not going to make the hair worse. It doesn't make it coarser, but it will look a bit more spiky just because of the angle. I think psychologically, a lot of women don't like the idea of shaving, but if it's easy and convenient, go for it. But threading, epilators, now they've got little hand pieces that it's almost like without wax, it removes it by the root. And with these smaller hairs, we do find that they don't need as regular a maintenance. So they don't grow back as quickly. The real dilemma comes in when the hairs become white, and then you're really they're not really amenable to the traditional hair removal lasers, and so you'd be looking at something like electrolysis or depilation.
Okay. And one last thing I wanted to talk to you about was pore size. So this is an interesting one, isn't it? That your pores actually seem to appear larger. Not a good look.
So, well, I've talked about this before because, like, pores, really, we all have them. They help our skin breathe, and they're really just where the hair follicle, the hair shaft comes out of. And they're like thumbprints. They're normal. But what happens is as we age, the scaffolding around the pore, which is due to, as we age, the collagen gets slacker. We don't have that scaffolding. So it almost looks more open and saggy. So they're more obvious. And the other thing is, when estrogen declines and you got more androgens, you actually activate your oil glands in some people. So you're producing more sebum and gunk. So you've got a clogged, congested pore that is unfortunately a bit slack. But this is where your creams come into place, your actives, sunscreen, and tightening lasers. There's a lot out there in terms of non-invasive skin treatments that you don't have to always upkeep. So unfortunately, a problem that we definitely see just because of that, the slackness of the skin and the loss of collagen support.
It's nice to know that there are things that you can actually do. Look, thanks, Shyamalar. We're out of time. Thanks, listeners, for joining us today. There's more information about Shyamalar and her beautiful Melbourne Clinic ode in the show notes. I'm Andrea Duval, and this podcast was brought to you by Prevention Magazine. And if you've enjoyed this episode, please subscribe to our podcast. We'll see you next time.